Good afternoon. I'm Alan Unell, and the series of videos is Healthcare Advocacy, where we face the problems in our healthcare system and then take actions to try and make a better system for all of us. We have a whole bunch of articles about Trump, and we're going to get to those in a minute. But down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is free. You can go to that link and sign up and get it delivered to your inbox almost every day. It has all of the background material, links to news stories, medical references, studies, and a whole host of references about healthcare, healthcare denials, reproductive health, together with points of contact for lots of organizations that are pushing for universal healthcare and better reproductive healthcare. Let's get started. Last week, we heard a call by Indivisible to go to your senator's office and ask them to bring the U.S. Senate to a halt to rein in Trump's illegal activities. Now, my wife and I live in Vancouver, Washington, and we're part of the planning or leadership team for Indivisible Greater Vancouver. So when we heard that, we decided we and Move On, Indivisible and Move On, would put out a call to have people go to our senators' offices, that's Senator Patty Murray and Maria Cantwell, over here in Vancouver, and have a petition for each of them asking them to bring the Senate to a halt until Trump gives up. And just come to the offices and sign the petition. Well over 100 people did. And we had a representative from Senator Cantwell's office come to pick up the petitions and talk to us. It turns out that after this was done, and this was done all over the country, this kind of activity, Democratic leaders in the Congress decided they're going to do just that. They're going to stop the Senate as much as they can. So, in my humble opinion, we're in a tough time here. Don't get overwhelmed by actions. You take whatever action you can and feel good about it, because whatever you can do is great and it's meaningful. P.S. I want to tell you, Rachel Maddow on MSNBC actually gave a shout out to our Indivisible group earlier this week for going to the senator's office. Anyway, let's talk about doctors that are actually going after the Trump administration. I love this one. There's a physicians group has now sued the Trump administration over health agencies' scrubbing of data sites and getting rid of data. Physicians have launched a legal challenge against the Office of Personnel Management, OPM, and federal health agencies for removing web pages from health-related websites. Doctors for America, that's the group, filed a lawsuit in federal court against OPM, the CDC, the FDA, and HHS over the removal of a broad range of health-related data and other information used every day by health professionals and researchers. The nonprofit legal group Public Citizen is representing the doctors. Thank you to Public Citizen. The removal of the web pages and data creates a dangerous gap in scientific data available to monitor and respond to disease outbreaks. It deprives physicians of resources that guide clinical practice and takes away key resources for communicating and engaging with patients. That's in the complaint. The removal of this information deprives researchers of access to information that is necessary for treating patients, for developing clinical studies that produce results that will accurately reflect the effects treatments will have in clinical practice, and for developing practices and policies that protect the health of vulnerable populations and the country as a whole. The suit challenges the actions of OPM in directing agencies to remove or change web pages and data, and the subsequent removal of the public information by the CDC, FDA, and HHS, pointing to the Administrative Procedure Act, that's law, and the Paperwork Reduction Act of 1995. There's a link to the MedPage story in the newsletter if you want. Go get them. Trump lackeys threaten employees at health agencies. This one is particularly egregious. Federal health workers are expressing fear and alarm after a website called DEI Watch List published photos, names, and public information of a number of workers across health agencies, describing them at one point on the website as targets. The website has since changed the word target to dossier. It's not the first time the American Accountability Foundation has created such a list. In December, it sent Pete Hegseth, then the nominee for Defense Secretary, a list of names of people in the military that it deemed were too focused on diversity, equity, and inclusion. This is according to the New York Post. There's a link to it in the newsletter. And this whole story was originally written by NBC. So this was interesting to me because I recall how the Trump lambasting of federal court officials and state court officials and jurors was particularly noxious, and there were lots of death threats going on at the time. So I decided to go to this website and look. They actually attack, and I think I have a link to it in the newsletter, they actually attack 7 health-related federal agencies and a host of employees. They list DEI offenses for these alleged scapegoats. One of those offenses, a $5 political contribution, $5. Another was that this person listed their pronouns on a social media site. Another offense just said they're anti-Trump. Look, this website is not a minor offense. Remember, when Trump complained about those people prosecuting him and their families, those people were the objects of derision, and they were flooded with death threats at work and at home. Trump pardoned the January 6th goons, and they are preparing retribution. They have said so in public, and sites like this are just a hit list to them. They threaten employees, and they focus his mob. That's what this website does. I think somebody ought to get a lawsuit in order and get an injunction and shut it down. Okay, I'm not a lawyer, but I'm calling out for legal help. The next item I have is a Washington state action. It's actually for tonight, if you can do it. There's a bill, HB 1639, under consideration in my state of Washington. It would make health insurance denial rates publicly available for Medicare Advantage Part C plans. Now recall that that's not Medicare, but it's a commercial replacement. Rates of denial for Medicare Advantage plans nationally are as high as 14%, lower than ACA plans, which can be 54%. Of course, for employer-sponsored plans, no information is available. Look, we all need data like this if we have to buy insurance to be smarter consumers. Hospitals need it because those denials, they'd waste people's time calling back and filing appeals, and those people could be doing other meaningful work. There is a hearing Friday morning, February 7th, at 8 o'clock Pacific time on this bill. If you want, in the newsletter, and I'll try and put it in the YouTube description box, you can sign in pro, say I like this. If you're in Washington State, you have to be a citizen here. Or you can sign up to testify. I'm going to actually email in my testimony. Let's talk about Elon Musk and U.S. government healthcare payment systems. Representatives of Elon Musk's Department of Government Efficiency had been working at the Center for Medicare and Medicaid Services, CMS, where they were granted access to agency systems and technology. This is according to CMS. CMS oversees Medicare, the health insurance program for older and disabled Americans, and Medicaid for lower income Americans. Together, those two programs cover about 140 million people in the U.S. When asked about this DOGE accessing CMS payment and contracting systems, representatives for the White House did not address specifics. They just defended Musk and DOGE's actions overall, saying they're fulfilling Trump's commitment to make the government more accountable. Now, one of the systems accessed by them, according to the Wall Street Journal, is the CMS Acquisition Lifecycle Management System, which includes information about contracts. The report, citing one of the people familiar with the DOGE work at CMS, said that Musk's allies have not been given access to databases that include identifiable personal health information of Medicare or Medicaid enrollees. Well, that might be good. The DOGE's access is read-only, meaning that their affiliates cannot make changes to the system, according to the Wall Street Journal. The U.S. Treasury said on Tuesday that Musk's team had been granted read-only access to the payment system codes, but denied that this cut off any government payments, including Social Security and Medicare. Although we did see that the Medicare payment line, I think it was the Medicare payment line, went down last week completely, and hospitals were sort of, no, I think it was Medicaid went down last week. And the hospitals were just SOL. They couldn't get paid. Charming. Look, if the government is looking for waste, fraud, and abuse like they claim, I have two places that can just fix it. The first, note that Medicare Advantage plans upcode patients. And when they do this, they steal about an extra $800 a month per patient from the U.S. government. And they can do this without doctor approval. They just have to review the records and go, oh, look, this person looks like pre-diabetic. Oh, they're a health risk. Upcode them. They do this all the time. All the major health insurance companies do this. And the Department of Justice is continually going after them to get the money back. Look, commercial insurance, that's one thing we can do. Go after them aggressively. Number two, commercial health insurance wastes $400 billion plus every year on unnecessary overhead. This is according to the 2020 Nonpartisan Congressional Budget Office report. And universal health care would save that much every year. Let's remind our representatives who think trolling in the system looking for savings is a good idea that they can save far more with universal health care. You can call or email your member of Congress. It's a little hard to get in this week because I understand some members of Congress are getting about 1,600 calls a minute. Anyway, you can call or email them and let them know, and senators, let them know that there are places to look for healthcare savings in government spending. Medicare Advantage insurance companies fraudulently upcode their patients, and there is wasteful spending on commercial insurance overhead at the rate of $400 billion as a country every year. There's a link in the YouTube description box if you want to call. Or, my favorite, text sign PXOOOE to ResistBot at 50409, PXOOOE, sign PXOOOE to ResistBot at 50409. I'll read you what you're going to send them. I'm your constituent, and I want Elon Musk and his minions out of the payment systems. Who knows what kind of damage they're doing and how much we will suffer as a result. They are now in the Center for Medicare and Medicaid Services examining who pays for what. Here's a suggestion. Almost every Medicare Advantage health insurance provider steals from the U.S. government by illegally upcoding patients. They get an extra $800 a month for every claim, for every patient they claim is more than nominally ill. Ask the DOJ. They have files on all of them. They sue them all the time. Go get the money from them. Number two, universal health care saves a minimum of $400 billion every year by eliminating wasteful insurance overhead to our country. This is according to the Congressional Budget Office, and here's a link to their report. Look, item 2, universal health care, fixes item 1, since everyone will have coverage with universal health care and private insurance won't have the opportunity to cheat. Once you've done that, then get Musk out of the government computer systems. That's what I've got for you today. Down below, you can like, share, subscribe, send me comments here or at Healthcare Advocacy 1, all one word, at gmail.com. Have a good evening.